Perfect. And now I am happy to introduce our guest speaker tonight, which is our nursing care manager, Stephanie Garcia. She is the nursing care manager here at the day program. She is a registered practical nurse who completed her education at Fanshawe College and has worked for McCormick Care Group since 2005. She spent the first 10 years working on the long-term care side of McCormick, primarily on the memory lane unit. And then for the last 7 years, she's been here on the day program side. She's really grateful for her experience working on both sides, as they have really contributed to the enriched knowledge and experience that she has when supporting people with dementia. So thanks, Steph, for being here with us tonight, and we are really looking forward to your presentation. So I'm going to send it over to you.
Thank you all for joining me today. This is my first webinar, so thank you, and I apologize if I go too fast, so please forgive me and bear with me. Tonight we have a full agenda. We will be talking about setting the mood during meal times and setting the atmosphere up for success. We're going to be talking about adaptive tools and at the dining table, chewing, swallowing, and coughing during meal times, dye textures and fluid consistencies, challenges and strategies assisting a person with eating during meal times, and then we'll have a period of Q&As at the end of the presentation. Okay, so let's get started. So doesn't this look lovely? A nice meal, everybody's smiling, and we all know that real life is not always like this, and that's okay. But what I'm going to do is share some of the tips and tricks that we do here in the day program that help with successful dining and to create a positive experience for everybody. One thing you want to do is that you want to play their favorite song or type of music, not too loudly, just enough for them to hear it in the background when you guys aren't talking. This is a really enjoyable way to set the mood. Those with dementia will correlate a positive experience with the music and meal times, making for successful intake during the mealtime. What happens is, I'll share a story. I used to have this one person, every time we would play music, she would slide into the dance floor and start dancing. And then she would share that, oh, my mom used to get so angry with me because I used to dance so much, I was wearing out the carpet, and everybody started laughing. They were talking about this one song and what they used to do during this song when they were younger. And before you know it, everybody's plates were cleared and they enjoyed themselves. When that person got picked up at the end of the night, I shared that story with their caregiver, and they were floored. They never heard that story before, and they learned something new from their person just now, from just simple a song, music, anything. Music is very powerful. I've also seen people who are nonverbal remember the lyrics and sing them out loud. So music and meal times are very positive ways to get them to eat more. And it's also very important to keep you present, you as a caregiver, with them at the table, making a really no stress at the dinner table. That way you guys could share stories, and they can look for cues too when eating, because sometimes they forget what to do. Sometimes those living with dementia may not always know what to do during meal times, and that is okay. It is our job to reduce any possible errors that they may make, and limit any feelings of embarrassment, which will then could lead to shame. When you have shame linked with meal times, that is not something you want. You want them to have zero errors and embarrassment. So ways you could do that is just have a plate, a cup, and one single utensil. That could help reduce those feelings of embarrassment, because once they feel that insecurity, they clam up, and then what happens? Their intake is affected. We need to set up a person for success, which can then can take some time for planning and creating a prepared environment. keeping a person involved in mealtimes is key, but caring, prompting, and adapting some mealtimes rituals, the person with dementia can be encouraged to eat independently. So, does this look familiar? Have you ever been to a restaurant, a fancy one, and there's like seven forks, 8 spoons, and you're like, what do I do? Which one do I use first? Sometimes folks with dementia feel like that. So reduce that confusion, reduce that anxiety, and just provide what is needed. Just a plate, a cup, and one utensil. Even if you have to do some pre-cutting before serving, that will also help, because then they don't like, how do I pick up this pork chop? Just really think about reducing some of that anxiety and stress during mealtime, which will help. Okay. So again, simplifying, omitting any unnecessary utensils. If you have different color plates, so here at the D program, we have blue, and when you put, say, white mashed potatoes against blue, the food then pops and they're able to see it. Ensure that the plate is stable and is stable, so meaning that it doesn't slip. Sometimes we have non-slip nodules placed on the backs of our plates so that they can't move it about. You can get something as simple as a, those cupboard liners that you get at the dollar store that are kind of rubbery. You could cut a little piece and put that right underneath their plate, and that won't budge it all for them. Provide a calm and unhurried atmosphere, and reduce any loud noises or abrupt movements. And making sure the lighting is adequate as well. You don't want to eat in the dark by candlelight. You want them to be able to see. You don't want any printed things on the plates, because then what did I get it, right? So we have some adaptive cutlery and tools that we use here to help us and help our clients feel like they still have their independence, they're able to feed themselves. What we have here are plate guards. These can be attached to any plate that we have. So what you do is you kind of hook it onto your plate like that. And what this does is help. So if when trying to feed self, the food doesn't go flying off the plate. It also helps with when trying to load their utensils. So if they're only able to handle one utensil at a time, they're able to push up against the plate guard and it loads their spoon or fork without any assistance of anybody else. We also have these nice weighted utensils, so it helps with tremors. And it has a nice grip here for those that have arthritis, and it's thicker. So it's not like a thin little thing that they got to pick up. It's a nice thick object that they're picking up. You could also have them where the spoon part, they could get right-handed or left-handed utensils where the actual part that goes into your mouth is curved in towards the mouth, which is kind of nice. So there's that wasted energy of trying to go in while they're shaking. It's also very important we use these aprons, because let's face it, meal times are very messy. So if we didn't have these, we would get lots of complaints from caregivers that, oh, there's so many stains on our shirt. This really helps. This covers majority of everything. And if you have to, we put it on their thigh as well. And this saves your clothes. And then it's nice because you can kind of scoop everything, all the spillage, and just toss it into shake it off into the garbage, so you don't have to worry about too much mess on the floor. And if there's mess on the floor, that's okay. As long as you know that meal times could be messy, it helps reduce the stress. Because you know that going in, we'll get to it, we'll clean to it, we'll get to cleaning it eventually. But if you think that meal times are always going to be perfect, robotic, no, it's not. And it just helps reduce the stress on everybody. We have cups here with lids. So this is really good for those that have soup. So because soup is very difficult to eat at the best times. I always get it on my shirt, right? So if you want, you can fill a nice cup, and if it's cool enough, they can feed themselves. You can also get cups that have two handles. And it will help with them bringing the cup to their mouths. We also have nosy cups. So these nosy cups are great for those that have mobility issues and are unable to, like hyperextend their back or their necks to take a drink. So it just helps with not getting your nose in the way when drinking. And I think that is it in regards to our adaptive program. So where do we get these items? We do usually get them with Duramed, and we do order from Amazon. These are some of the pictures that we have here. Chewing and swallowing. So this is very important. And if the person loses this ability, it could be very dangerous during meal times, and we don't want to. So what we are wanting to see is active chewing. If you're noticing there's chew, chew, break, chew, chew, break, you really want to keep an eye on that. You want to coax them to chew some more by touching the side of their cheek. Say, hi, Jim, let's keep chewing, please, and make sure that swallowing action is happening. Taking little sips of water in between each bite helps, but you really want to make sure that before you load any more food into their mouth, that they are in fact swallowing everything. The worst thing you could do is have pocketing in the mouth, because then you'll have risk for choking and aspiration. So smaller little portions as you go, and chew, make sure they're chewing, and then swallow with bits of water. Coughing during meal times. If it is noted that there is increased episodes of coughing specifically during meal times, it's very likely the diet texture or food consistency is no longer appropriate for the person. It is advised to seek medical attention to help rule out any possible swallowing difficulties that could be experienced during meal times. A referral to be assessed by a speech language pathologist will help identify the correct diet type during swallowing assessments. So there are different types of diets. There are regular, soft, minced, puree, and for food types, there are regular, nectar, and honey, and pudding. Types of questions you want to ask yourself, and you want to complete a full assessment before actually assisting somebody with feeding is the person awake? Are they alert? If not, maybe try a little bit later when they're a little more awake, able to chew and swallow. Is the person seated correctly? Are they too far and they're leaning like this? Or are they way too close and the range of motion is kind of awkward? Are they too high or too low? It sounds like Dr. Seuss, but those are the types of questions I ask when I quickly look at somebody who requires assistance during meal times. I then adjust accordingly. Are they slouched? Is someone sitting at the dinner table like this? You don't want them to sit like that because there's no way that they're able to swallow efficiently. You want to be able to prop them. If they have a stroke arm, you could prop a pillow or a rolled up towel or blanket to correctly have them in their chair. You could have multiple pillows, actually, so one here and one here, and have them propped up nice and straight. You want their neck to be aligned normally, not hyperextended or slouched down. This way here, there's risk for aspiration and choking. And then this way, there's no way that they could properly swallow because a lot of it will come right out. Are they able to recognize the food as food, as something to eat? Or are they reaching for a napkin and sticking that in their mouth too? If so, just remove the napkin. It's not needed at that time. Just have the plate, the utensil, and the cup. That's all there is that's needed. And how much assistance is required.
Okay, it looks like we had a little technical difficulty there. So Steph, you'll have to share your screen again for us.
Okay, how do I exit? And then share. Sorry, guys. Sharing. Can you guys see that?
Yep, and then if you hit the from current slide button, it should just open it right up to there.
No. Custom current.
Yeah,
Here's
that
the-
one right there.
Yep.
Yep. And then maybe just go back a slide or two. Oh, okay, yeah, and go forward one more.
No, I was.
Yep, so I think this is kind of where we lost connection.
Okay.
All good.
And Stephanie, we've just had a little request there too. If you could just speak up just a tiny bit louder there. I think there's some trouble hearing you.
Okay. I'm composed. Can you guys hear me okay now? Okay. So it is okay if they want to walk around, just provide them with finger foods. And before you do that, you also want to ask, is the person in pain? Why won't they sit for long periods of time? And just have that talk with your healthcare provider. And if everything's okay and that's what they want to do in that moment, that's okay. It doesn't need to be picture perfect at meal times at all times. Let them guide you as to what they're comfortable with in the moment. Memory loss, forgetting to eat or forgetting that they have eaten. So I've heard this a lot. Some folks, they'll need some reminders that they need to eat. They forget, they get busy. So a reminder phone call will help for those that live alone, or you could cue them with pre-cooked meals or frozen meals to heat up in the microwave. You can also set alarms in the home to cue them to eat a little bit. Strategies for those that forget that they have eaten already, you could offer a small healthier snacks, multiple smaller meals throughout the day, and redirect the person and let them know that supper will be ready shortly. Now, this could be very frustrating, especially when you're in the middle of making dinner. So a little note, say, hey, I wrote you a little note, why don't you read that? And oftentimes they'll reach into their breast pocket and say, okay, dinner will be ready shortly. They'll fold it back up, put it back in their pocket, and go about their business in the house. And they may come back in 5 minutes, but at least you had 5 minutes to alone with you cooking your meal. Notes really do work, and we do use those in the day. Responsive behavior. So strategies not to rush the person. They may start and stop eating it many times throughout the meal. Give a good hour for a meal. Take breaks, engage in other activities, and try again. Consider having on-the-go food items to offer throughout the day, and consult a healthcare professional for additional strategies to help support, or you could give us a call too, and we'll share our tips and tricks that we use in the day program for your person if they do attend. Because a lot of our folks do eat, they do eat our food here, so it's good. Overeating. So we do see some of these behaviors here, especially for our frontal temporal lobe dementia folks. They do have this over compulsion to eat, or they forgot they have eaten, and a lot of the times is it due to boredom or is it depression? Try to engage them with meaningful activities or take them out for walks. You could try to offer healthier snacks and have them ready. Fruit, yogurt, smoothies, applesauce, that's good. Stagger your food items so that they only see one item at a time instead of a whole tray of food at all times. Serve soup. Soup is really good for tricking your body to think that you're full sooner. And salad too. Any roughage, any high fiber foods will help keep bulk in and make you feel fuller. You also may want to consider locking your cupboards or your fridge doors. We do that here in the day program. We have locks on everything just for some of those folks that like to rummage and to overeat in that sense. And just reminders away from the kitchen. Take them for long walks, keep them busy in other ways, and keep them out of sight. So out of sight, out of mind will also help. So now that we have all those things to consider prior to actually assisting somebody during mealtime, now is the time to assist. So I've done, I've completed my assessment. I know my strategy on how I'm going to go about assisting a person. I always start with a drink. I give them a small glass of water. It doesn't need to be large, because oftentimes the older we get, the less we sense that we are thirsty. So oftentimes, a lot of us are walking around and we're dehydrated. So the best time to hydrate and to think about hydrating is during mealtime. So I always start with one full glass of water, just a small one, and I make sure that that person drinks the entire glass. That way your body is preparing for the actual meal. All the digestive juices in your gut start flowing, and actually in your mouth, it starts there too, because the second you put something in your mouth, that breakdown starts in your mouth and down as it goes. So the drink helps with that. You're going to watch the chewing. Sometimes a lot of people don't like to open their mouths fully as much as they want. So what we do use is a tiny, tiny, tiny dessert spoon. It has a long, long handle. I think this was really meant for ice cream sundaes, like in the large cup, so a tiny little spoon. What we do is we load the tiniest amount of food on there, and those that don't like to open their mouths too much will even lick the spoon, and then we just keep dipping. And with the hour that we have, we're able to feed everything that's offered on their plate, and they're able to eat everything with time and patience. So they are able to get the full nourishment of just the tiniest little bit each and every time. And each and every time we do that, we offer a sip of water to ensure that we wash down everything that was offered to them and ensure that they are swallowing. We also offer meal replacements in forms of smoothies, or we say, hey, you want an iced coffee, if that's what they're used to, or during winter months, a meal replacement can be heated, and then it could be like a hot chocolate. So that could also help too. So another tips, only feed a person when they are awake and alert, and stop if they become too tired. So how do you know when it's time to stop? Is when they purse their lips, they turn their head, you just know that they're no longer interested. And actually, if you continue to feed, they will become agitated, or if the person has fallen asleep, clear sign, do not continue. Don't stand above the person. This motion of trying to eat and swallow will actually cause a person to choke. Go slowly and be patient, one mouthful at a time. Again, washing each mouthful down with a sip of water, and encourage a person to self-feed as much as possible. This will help sustain their ability much longer. It's important for the person to be sitting straight. Like I said, we don't want them like leaning back or curled forward. Adjust with pillows or blankets or towels if needed. And lastly, have them remain seated for at least 30 to 45 minutes or longer after each meal. It's so important that you keep them sitting to allow for the digestion to occur. If you lay them down for a nap or for the rest of the night, their stomach could be very upset and could even get sick in bed. So very important that you keep them up, have them watch TV with you, read the newspaper or a book with them, play cards, anything, but just keep them up a little bit longer, just for an hour at the most. And that is it for today, and open to any questions.
Okay, perfect stuff. So yeah, next we'll kind of go into a question and answer period. So if anyone does have any, more specific questions, you can pop them into the Q&A, and Allison will be monitoring that. Allison, do we have any questions to start us off?
Hi, everyone. Allison here. I don't have any questions in the Q&A just yet, but I do have some of my own questions as you were talking, Stephanie.
Okay.
I was wondering, so feel free, folks, to pop your questions in that Q&A box there, and we'll be happy to have Stephanie address them. You mentioned the pocketing. I wondered if you could explain that a little bit more, like what is it and why does that happen?
It's when it's the chewing, like the chewing becomes so much of a chore that they forget to swallow, or they are able to only swallow the bulk of, I have my cheek here, I'm holding it, the bulk of the food and swallow only the fluids. So sometimes they could get confused between the two textures, and that's when it's really, really important to have somebody assess their swallowing ability so we could get the right texture for their diet and the right consistency of fluid, because that could get very dangerous.
Okay.
Yeah.
Sure.
Okay.
I was just going to jump in quickly when you're talking about the assessments. I think we've mentioned it in the previous webinars as well, but if you're connected to home and community care, if you have a care coordinator, they do offer speech language pathology in the home. So if you are thinking that, your person might be having troubles with swallowing, or they might need a different diet texture, you can talk to your care coordinator and they can put in a referral for that service to have a speech language pathologist come in and do that assessment. And then if they do recommend a certain diet or fluid type, then that's something that we can follow here at the day program as well. That's all.
That's great. Thank you. And we've got a couple of questions here in the chat box, or sorry, in the question and answer box. So one person is asking if we can get a PDF file for tonight's info. So I will mention that we are recording tonight's webinar, and so eventually we will have it on our website. But I believe that we could likely also probably have the PowerPoint slides sent to you. If the person, I believe your name is Mary, if you'd like to send me a message with private lead and provide your email, I can make sure that we can get you a copy of the slides if you'd like that. So thank you so much. All right, we've got another question here. So do long-term care homes use some or all of these strategies?
Definitely. Yeah, this is, we use the same provider as the long-term care homes for, with these devices. We'll recognize right away, oh, this person can't tilt their head back. Let's use a nosy cup. We know these are very common things in long-term care home as well, especially these plate guards. Amazing. Like, it just helps maintain their independence during mealtime so that nobody actually has to load their spoon for them. They can do it themselves. And customize, again, left-handed utensils versus right-handed. You could get those too, and ask for them specifically for your person.
That's good to know. Thank you very much. Okay, and we've got another one here. So would you recommend meal replacement drinks like Boost for one who's diabetic? And then there's a second part, but I'll ask that in a second.
Yep, you could get specific ones for those that have diabetes with a less sugar content. I feel like I'm not quite sure offhand what it's called. There's different types of boosts, or like an Ensures for, I think Christina mentioned in our first webinar.
Yeah, I think it's Glucerna is what it's called. And she also included, they have a Glucerna club as well. So I have a poster for that as well. So I could certainly send that to the person that asked that question.
And the second part, yeah, it was, would a meal replacement drink, could that be added to a meal, or would that be the entire meal? How many calories, I guess, would that replace?
Depending, I believe I seen on the can was like 200 calories, or depending on how much you intake. But if you find they only ate half, and normally they would eat the entire meal, depending on how much weight they are required to gain is another thing you want to consider. But yeah, it just depends. Like, if they didn't really feel like their meal and only ate a quarter of it, just certainly replace it with a meal replacement. But if they ate the whole thing and asked for seconds, don't worry about it. And it's those that like skip breakfast and lunch throughout the day, you could offer a meal replacement for sure.
And on the meal replacement there, I thought that was a really neat little tip you suggested, Stephanie, to heat it up as like a hot chocolate or something like that in the wintertime. That's a great idea. I was just wondering too, like, could you ever add like I guess you wouldn't want to do that, but hear from you. Would you ever add any like protein powder or anything to a meal replacement, or could you put it into a smoothie with banana or something?
Oh, certainly, you could become a mad scientist and add whatever. At some points, you'll know, because sweets are the sweet receptors in your on your tongue are the last to go. So I've had people where I was assisting with feeding and they're just like, mashed potatoes, and they just go about the motion, only ate half. But then the second dessert comes up, they perk up, their eyes light up, and they're eating everything and ask for seconds, right? And it's important to provide what they like if intake is a concern. If you're trying to get them to gain weight, and gaining weight is having chocolate ice cream versus strawberries, go for both, or even just the chocolate ice cream. If you want to have them bulk up in that sense, you could do chocolate ice cream, chocolate meal replacement, and a protein powder. Get it all in there with some extra fluids. It's a meal, it's desserts, it's fluids, anything just to have that intake.
Yeah, I just wanted to make a comment on that as well. I heard that some people will use the Ensure or the Glucerna as like an ice cream float kind of situation as dessert. So they'll pour the drink into a cup with a scoop of chocolate or vanilla ice cream, and that's a good way to get calories in. And then that's kind of capitalizing on those sweet taste buds and dessert as well. So I thought that was kind of neat.
Great ideas. Thank you. This is a really good question here in the question and answer box. What do you do if a person just isn't drinking enough water?
I would offer fruits that they enjoy, like watermelons. There's ways to sneak in foods that way. Popsicles is a good way on a hot day, and breezies, ice cream. I think fruits is a good substitute if they don't like that. But again, smoothies, another way. It is hard with drinking, especially. I would have to know the person a little bit better to answer that fully. But those are small examples of how to increase hydration other than drinking from a cup. And if that person wants to reach out to me, by any means, I can speak with them further.
Okay, great. Thank you. Since we're on the topic of drinking too, I always wonder, what works better too? Like a lot of people may be tempted to use straws, but what would you recommend, using a straw or drinking from a cup? Or
depending on the person's ability to swallow. If you're noticing a lot of coughing during the meal, probably a straw isn't the best, because the fluid will get hit the back of the throat before the person's able to catch it and swallow it. Like the normal mechanics of swallowing, that's involved. But if they're on the go and there is no risk of choking and they are comfortable, or if they have an injury and they can't tilt their head back when drinking, yes, the straw is appropriate in that sense. But when sitting at the table, it is easier to use a nosy cup and provide a drink from a cup. And it's all very individual based on their ability to swallow.
okay, so that ability to swallow is really important to sort of look at and observe. Yeah.
Yes.
Okay. Excellent. And just kind of going back to the question about knowing what kinds of foods. How do you know when someone should be put on pureed foods?
So a lot of choking will happen. So usually what happens is, do they have all their teeth? You want to be able to look at that. You want to look in their mouth. Are there any sores? Are they not wanting to eat because they don't see their mouth? Or do they not have the tools to actually chew their food? So you want to think about those things. You want to think about, again, lots of coughing. What's going on? How come they're not able to, why are they coughing? And why aren't they able to swallow? Are they pocketing? And are they not opening their mouth? So the not opening their mouth, we go right to puree in that point. So we would puree the meal, and if all they're able to tolerate is open it just a little bit, then that's when we get them to lick the spoon every once in a while.
Gotcha. Okay, thank you. Any other questions out there? We've got some more time here if anyone has any other personal questions. And again, if it's something that you don't feel comfortable asking, there is an anonymous option. So you just open up the question and answer box and click the anonymous button at the bottom, and you can ask your question there. I got thinking too when you were presenting, Stephanie, and you mentioned that some folks, you know, during a mealtime might get agitated or frustrated, and just wondered, like, what would be an example of a responsive behavior that you might have seen during a mealtime, and how was it handled?
Responding to outside stimulation. So if the phone is ringing during the meal, answer the phone, right? Door slamming, things like that could get somebody to react. I've seen, say, a fly come buzz around, get out of here, and swat, and then spilling a drink can even. So having these lids at the table really helps reduce any of the possible agitation that could cause. And just being frustrated in themselves that they don't remember what to do at the dinner table. It can be very scary not to remember what to do with a spoon or a fork, or not remembering where they are in the room. And just reorientating them, being calm, say, oh, Jim, this is where we are. We're having some dinner. And just a matter of fact, some folks, they get really agitated or scared that, how am I going to pay for this meal? So just reminding, yeah, we're home, we're here, I've made this nice dinner just for you, and don't worry about paying. It's okay, I take care of it for you. Things like that.
Easier said than done, Steph.
Oh,
I'm just kidding.
I had one guy, he's like very agitated, didn't want to touch or even look at his food. And when asking and sitting with him, I'm like, what's going on? I forgot my wallet, I can't eat here, right?
Oh,
I had to say, well, I won the lottery and I bought everyone dinner. So please do me, like, you give me great joy if you finished your meal. He's like, okay. And he finished his meal. So
you're quick on your feet.
Be very creative.
That's a good one. I know sometimes in long-term care too, they create like meal vouchers. And so they'll print out a meal voucher and give it to the person saying that, you know, today's meal's on us.
That works too.
Great idea. Good idea. There is another question here in the Q&A. So any meal ideas for someone who can only use a spoon?
Sorry, can you repeat that?
Yeah, of course. Do you have any ideas for meals for a person who can only use a spoon at the moment?
You could still do pasta as long as you cut it up. You could do stews, rice, potatoes. That works out well. Soups, depending on if there's any tremors, but then I would go with a cup and lid option. I think that's all that I can think of at the top of my head. Oatmeal, cereal, those are great things that they could assist. And again, if you provide aprons to protect their clothes or their lap, it's going to get messy, but that's okay.
Yeah, and I think that plate rim there that you have in front of you too is super helpful, because really with the spoon, like, you can scoop up most things, I think, as long as they're you know, cut up pretty small.
Yeah,
Most meals.
This just helps with loading the spoon. Like, you don't need the second, like the fork to push it in. It loads the spoon for you, which is so good.
That's great. We've got another question here. So someone just asking about those aprons. So where can we find those aprons that size? Because those are a nice size to cover. And a side question too, you know, how do you convince someone to wear it?
if you, okay, so we, here in the day program, it's very normal. Everyone gets passed around. We ask if they need assistance, but if you're wearing it too, they will mimic and follow your cues at the dinner table because it's now normal. Or this is what we're doing. We're gonna cover our clothes. We're gonna make sure that I don't wanna do that much laundry. Doing laundry is so hard. So why don't we make sure we protect our clothes? And that's one of our tools too. When we say, oh, Bill, you know what, let's put this on you so your wife doesn't have to worry about cleaning up anything when you get home, right? So it's just one of the tools that we use. This guy is pretty big. It does, I have mine strapped on now. It goes right to my thigh. So when you go to sit down, it covers this portion of your, almost fell, of your thigh. And then having this second one even covers your pants. We do purchase these from Duramed as well. And you can get a whole bunch. And we had a lady actually donate a whole bunch from old t-shirts. And so they didn't have this pattern. It looked more like a t-shirt and funky t-shirts. Kind of nice when we were pulling those out for some of our folks. So then they were like, oh, that's neat. So I'll have to send a picture on the website of what they look like.
Yeah, I wondered even if, like, as a quick fix, if you could just use it like a button down shirt, but on backwards, slip it on backwards. If you don't, if you need something quick in the moment, just a plain button down shirt, put on backwards would work kind of the same.
For sure. Get creative. Anything that works. And you have to also wear it too, so that they don't feel left out, like I'm the only one singled out wearing an apron, right? So it's important that everybody takes part and normalize it.
Excellent. Well, that's all the questions that are in the Q&A. I don't know if anyone has any last minute ones that you're thinking about things that are going on at home, or actually we have the bonus here that Stephanie has also worked on the long-term care side. So if you had any questions about eating and food and whatnot when you're at the care home, then she could probably answer those too.
Sure.
Oh, here's one here. I think it's just a comment saying that a person here has found a disposable bib product called Neat Sheets. They stick on and there's some nice patterns, and they found them on Amazon. Oh, lovely. We'll have to look that one up. That sounds pretty interesting. Thanks for sharing, Carol.
Nice for cleanup too, right? Instead of shaking it off and doing more laundry. Just collect
exactly.
it.
Exactly. That's great. All right, Lindsay.
All right. So yeah, I guess we'll kind of wrap it up there. And like Steph said, right, if anyone does have any questions, or if they're struggling with any, meal times at home, you can always reach out to Steph here at the day program, or, any of our day program staff, and they might be able to provide you with some tips and tricks, or, what's working well for us here, and see if we can help you guys implement stuff at home as well. So I'll just kind of wrap up with saying, thank you to Steph for coming and presenting with us tonight. It was a really great presentation, lots of good information there. And like we mentioned, it's going to be, recorded, and we'll post it on the website so that you can refer back to it any time, or you can share it with those who might benefit. This was the third and final part of our food, nutrition, and mealtime webinar series. So I just wanted to extend a thank you to all of those that joined us throughout the last 3 weeks. We hope that you were able to find some helpful tips and tricks throughout the different presentations. And just wanted to share that next month, we're offering a virtual workshop in partnership with the Southwest Self-Management Program, and it's called Using Your Brain to Make Decisions. So it's a healthy living workshop designed to help people develop strategies to support a formal approach to making health-related decisions. There's 2 workshop dates that you can sign up for, and there are limited capacity for the workshop. So if you are interested, we would encourage you to sign up as soon as you're able to, and you can do that through Natalie, our administrative assistant. And the two dates are July 13th from 7 until 8 p.m. or July 28th from 10 to 11 a.m. So that's kind of what's coming up next month. And other than that, again, just thank you all for being here with us tonight. It was really great. We hope you learned something, and wishing you guys all a nice rest of your evening.
Thank you. Take care, everybody.
Take care.
Bye.